Hello, I'm Anshu, and today we'll be talking about machine learning and AI applications in healthcare, specifically pneumonia detection. I'm a rising senior at Winchester High School in Massachusetts. I'm passionate about AI and ML applications in biology and chemistry. I have been a chemistry teaching assistant since my junior year of high school, and I love to tutor and mentor. My extracurriculars include coding and hackathons. I'm editor and webmaster of my school's Latin club, and I'm a senior classical Odissi dancer, and I play two sports. I aspire to be a researcher in the intersection of biology, chemistry, and computing. So, what is pneumonia? Pneumonia is an acute form of respiratory infection that is most commonly caused by viruses or bacteria. Pneumonia causes lung tissue to swell and can cause fluid or pus accumulation, which reduces ability to take in oxygen. It is a mild to life-threatening illness in people of all ages, and it is a global health challenge because it has different mortality rates depending on age and region. It is the single largest infectious cause of death in children worldwide, with under 700,000 children under 5 dying every year due to these upper respiratory infections. Progress in reducing pneumonia deaths in children under 5 has been significantly slower than other infectious diseases, such as malaria or measles. Too few children with symptoms of pneumonia receive the care they need. So, diagnosis and intervention needs to be done right at the right time, which is where these types of data and AI and ML models can come in. So, there are 8 modes of data that are often used to determine pneumonia infections, imaging, pulse oximetry, blood tests. In the future, there are talks of multimodal AIs, which will use multiple types of data to determine and predict pneumonia. But for the purpose of this presentation, we'll be looking at using imaging data like chest x-rays to take pictures of our lungs and look for signs of infections. Because this is imaging, it's an application of computer vision, and we'll be inputting images and outputting pneumonia versus healthy. So this problem type is classification. Here are some examples of some x-rays that would be inputted into the model. For example, a healthy lung, and then a pneumonia detected lung, which shows the fluid accumulation in one area. And these are the types of data that our model would be taking in. So when we are determining which type of model to use, there's a lot of ML models out there that could be used: logistic regression, KNN neighbors, nearest neighbors, decision trees, or convolutional neural networks. Decision trees extract features from images and then classify them based on shape, texture, and intensity of the lung region. But even with the adjustment of parameters, there was still room for improvement on model accuracy, and ultimately my team decided to go with convolutional neural networks because they can accurately and automatically recognize objects within images. So what are CNNs, convolutional neural networks? They're deep learning models that are best for image classification. There on the right top is a diagram of what a CNN is composed of: convolutional layers with each layer composed of different neurons. Convolutional layers consist of filters that scan through the image and identify features like textures and more complex shapes, and each neuron in the convolutional layer is connected to a small region of the input image known as the receptive field. This kind of connectivity allows CNNs to capture spatial hierarchies, which are essential for understanding the structure of visual data. This ensures that features detected in one part can be recognized elsewhere, enhancing the robustness to positional changes, which is very important for the amount of data and the variance in a data set. They can learn complex and abstract representation, with early layers detecting simple features and deeper layers detecting more complex structures. On the right is a graph of my model running. So you can see on the training data set, the orange line, it grows in accuracy the more I train it, the more epochs or cycles it goes through. And so more data, more training, more accurate. My model achieved around 78% accuracy, but more data, more training, it would achieve more and more accuracy. CNNs are highly effective for these tasks, and our metrics for classification can be described in terms of a confusion matrix, or what we would get back. So there are 4 different results we could get back: a true positive, false negative. Those are patients that have pneumonia truly. On the right, you can see that represented in colors as well. So true positive means they truly have pneumonia. False negative means they have pneumonia, but they were mistakenly classified as no pneumonia, the bottom left, and no pneumonia being true negative and false positive. Truly negative, they truly do not have pneumonia. False positive, they have pneumonia but were detected to not have pneumonia, which is dangerous. So those are some of the outputs we would get from a CNN. To make sure our model is as accurate as possible and make sure those false results are as little as possible, we want to make sure our model can handle a broad variety of input data. And one way to do this is to augment our data. By intentionally making some alterations to our input data, we can train our model to handle a variety of outputs. So rotating, scaling, shearing, this can help our model handle discrepancies in data, especially if it is being used globally. There will be a lot of variance in how data is collected and how the model is taking them in. So we need to make sure that our model is robust enough and has been trained on a diverse data set. So when we're thinking about applications of AI in medicine, we need to think about the ethics. And some questions that are raised are, what happens when an AI makes a mistake? And are mistakes worse than others' mistakes? So who's at fault? The physician, the hospital, the data scientist who created this algorithm? These issues still need to be discussed before AI becomes commonplace in radiology. And some mistakes are definitely worse than others, like a false positive, meaning putting a patient through unnecessary or even harmful medical stress and procedures. False negatives mean a patient in need of treatment goes unnoticed until it is too late. These AI radiology machines need to become significantly better than humans for there to be such a large-scale change to the practice. Another question is, will AI replace radiologists? And no, in its current stages, AI will not replace radiologists. It's best used in tandem with radiologists as a tool. Radiologists need to create comprehensive collections of use cases and test data, which will take many years and further supports the necessity of radiologists within an AI world. These tools can help with decision-making in detecting and diagnosing pneumonia, not replace. Radiologists also perform other tasks aside from image analysis, like consulting with other physicians and evaluating patients based on other medical records and test results, and they need to discuss these findings and results and procedures with patients. This kind of human connection cannot be replaced with AI. If anything, this will allow radiologists to focus their efforts on other tasks. Ethical use of AI works on 4 principles: beneficence, non-malfeasance, autonomy, and justice. It must act for the benefit of a patient, an obligation of a physician to not harm the patient, and patients have to have the power to make rational decisions and moral choices, and it must be fair and equitable. So collecting data needs autonomy and justice in mind. It has to be obtained with patients' informed consent, and data should be given to include a diverse set of patients, gender, race, socioeconomics, to build the most accurate models that we can. And model predictions must improve diagnosis quality, not hinder or harm. It's supposed to help physicians. So when thinking about AI in healthcare, it's limitless, and these are my references. I would just like to acknowledge my mentors and thank JHLC for allowing me to participate and share my findings. Thank you.